In the steep escarpments of Lake Albert, western Uganda, lies Ndaiga, one of the most hard-to-reach fishing communities in Kagadi District. Here, mothers face challenges to access antenatal and maternity care. Every pregnancy carries the risk of tragedy when services are hours and thousands of shillings away. But one man, an MPHL alumnus, is working to change this story. Selevano Thembo, a surveillance officer in Kagadi District and graduate of the Master of Public Health Leadership at Uganda Christian University, is using his training and sphere of influence to advocate for safe motherhood in Ndaiga. Despite national progress in maternal and child health, Ndaiga's women face barriers. The nearest hospital is 15 kilometers away. Reaching it requires crossing steep escarpments or hiring a boat, costing up to 20,000 shillings, more than many cannot afford.
We had a community dialogue in this place in Kitebere, and the community dialogue was on the post-COVID challenges. One of the challenges they addressed was they have missed antenatal services for the pregnant mothers in the community. They have missed immunization services for the children that have been delivered, and it had taken them like 4 or 5 months. I went on to ask, what could be the problem? They said, first of all, we are far from the facility, Ndaiga Health Center 2, and also the nearest Health Center 3 is in MPHL Health Center 3, but you see, you have to access it by climbing this escarpment. We agreed that how possible now can we access Ndaiga Health Center 2, which is near? And the leaders said, we can use water transport. Then I said, how? We need the boat, we need the engine. They said, we have the engine, we have the boat. Those are the leaders. So the mother said, how much can it cost us if we went as a group and we go to Ndaiga? So they said 5,000 is enough to take all of us and come back. So we started in October. They mobilized the mothers, they paid the money, they hired the boat, they took the mothers to Ndaiga Health Center 2. So we received them, we did the possible that we would manage, and they were happy that day.
One mother got complications on her way to Ndaiga Health Center 2 while on the boat. The turbulent waters delayed their arrival, and due to a lack of swift communication, these complications resulted in the death of her unborn child.
We were moving on the water, which is also a risk. For the first time, we took 56 pregnant mothers. Secondly, we carried 78 mothers. By bad chance and heavy wind and poor communication from here to the health center, one of the women started hearing badly. Then from there, the doctor tried to reach on her. The doctor failed. We transport her back from the health center up to here. Then we transport her to Kituti Health Center in Kikube District, where the woman delivered a dead body. It is very impossible to carry a woman who is now hearing badly to the hospital in Kagadi, because the road, we have poor road network. Here we do use to carry such person. We put her in the boat, then we transport her to Toroko, where she can get forward to Toro, to Buhinga Hospital, or we cross to Kom.
The distance from Kitebere to Ndaiga itself as a health unit, 15 kilometers. These mothers will not afford to move from Kitebere to Ndaiga.
When the waterway found us there, we have to sleep there. And the moment to sleep there, where are you going to sleep? We don't have money for lodges, and the people also sometimes they go when they're hungry, there's no food, so we suffer like nothing. And even the road from here to go the other side was not good, as you are seeing now. When the rain falls, you find that the road is very sleepy, and the transportation cost is very high, so we couldn't afford even.
Determined to act, Thembo mobilized his community. Through dialogue, training, and advocacy, he united mothers, traditional birth attendants, and local leaders. He also worked with partners to deliver mama kits, mosquito nets, and health education, ensuring that every mother feels supported before and after childbirth.
Actually, we test for HIV and syphilis, nutrition as well. You see how the condition of the mother. If the condition of the mother is not all good, we health educate and we refer that mother for further service. And if we found it is near to term or to deliver, we so far educate and also try to guide her where she can go for delivery.
Kandi nyowe mukurora kwange nindora irwaro rino rituyambire muno abo kuba hano Kitebere distance eroho distance nyingi muno kuruga hano Kitebere kwikantoroko.
Today, these efforts are bearing fruit. At community outreaches, mothers gather in their hundreds to receive antenatal care and immunizations for their babies. On this day, Save the Mother's Executive Director, Dr. Mushin, joined health workers from Ndaiga and Kagadi Hospital, personally attending to over 40 expectant mothers.
They are now picking up. Like the number of mothers is increasing, and today now, you see that in our reports, maternal reports, antenatal attendance is improving, and I am happy that we are now recording mothers who are coming in first trimester. According to the target that the district has given us on first trimester, we have surpassed it. This is because of the knowledge and the skills that I got when I was doing my MPHL. And especially the leadership component is so good that it allows you to think more for the people, for your communities. The health background is there, but a component of leadership is important because it allows you to say, if it was me, how would I feel? And you say, now, can we see how we can plan and find out something for them? Save the Mothers, Mother-Friendly Hospital, and other partners of Save the Mothers, because we even have very many. Dr. Jean is in Canada. This is her fruits, because all this I'm doing and what the mothers of Ndaiga are benefiting from the knowledge generated by Dr. Jean Chamberlain, who is in Canada. I would request that Save the Mothers, East Africa, Mother-Friendly Hospitals, because there are now many, can give us a hand of picking this one as an outreach, and we shall be happy if this outreach is sponsored by Save the Mothers.
From the escarpments of Ndaiga, hope is rising. Through innovation, advocacy, and community leadership, safe motherhood is becoming a reality. Save the Mothers, working together for healthy mothers, healthy babies, and healthy nations.